stating that there is not enough evidence to support their safety or clinical effectiveness. The National Health Service of England announced late last week that it's going to limit the use of puberty-suppressing drugs, with a few exceptions, for children who are enrolled in clinical trials. Now, this move comes as research continues to dispel the lies that are being pushed by the pro-trans activists regarding these drugs, and as studies also reveal the harm that these drugs are causing children. Well, joining me now to discuss this is Dr. Jennifer Bauwens. She's the director of the Center for Family Studies here at the Family Research Council. And by the way, prior to her work here at FRC, Dr. Bauwens worked as a clinician and researcher addressing the effects of psychological trauma, things like the traumatic events of 9/11 and that type of thing. So, Dr. Bauwens, welcome back to Washington Watch. Always great to have you.
It's always good to be with you, Jody.
Well, listen, this is big news coming out of England. Some are describing this as a ban, but probably that's not completely accurate. Tell us what this decision actually does.
Yeah, basically what's going to happen now, and this, by the way, this follows the closure of the Tavistock Clinic in the UK, which was, of course, the clinic that did so-called treatment of gender dysphoria. And so this is another move to basically say that there really isn't enough evidence to dispense puberty blockers. And so the UK has decided that they'll basically offer puberty suppression in the context of clinical trials. Now, of course, we wish that that would be a full ban, and really a full ban by no research, but this is a huge step towards seeing these terrible practices no longer be available, at least in one country here.
Yeah, and it's got to start somewhere, and how great that it's starting, in England. I mean, this is, like you said, this is a huge decision. Now, it seems to me, well, really it is the reality that the NHS has reversed course on this. I think we have all watched globally as the push for these transgender puberty blockers and surgeries and so forth have been, seems like just marching down Main Street. And now we're watching, particularly in Europe, some European countries beginning to pull back on this. Why the reverse course on this?
Yeah, and I think one reason that we're seeing so many European countries in particular pull back on these practices is, for one, they've been doing it longer than the U.S. In terms of having some kind of systematic approach. So what we're seeing now is when these countries actually look at the literature that's been used to support employing so-called gender transition procedures, what we see is that they have to be honest, and they look at the evidence and they say, you know what, there really isn't evidence to support these practices. And that's one good thing that we're seeing in terms of honesty in the scientific discourse, because, gosh, we certainly haven't seen a lot of honesty over the last few years in a number of disciplines, but certainly when it comes to the transgender issue.
Yeah, that is so true. And across the board, it seems like we have seen so many instances in the last several years of the entire medical industry being used for political purposes rather than actual science and medicine for the good of people. Now, let's go back, if we can, Dr. Bauwens, and just remind everyone, what are some of the negative effects that these drugs can actually have on young people, on children?
Well, there's more evidence in about the physiological harms. Although we can certainly speculate about the psychological harms. But when we're talking about physiological harm, we're talking about cardiovascular issues, cancers, low bone density, hot flashes, infertility. And these things are pretty well established. And actually, more recently, there was a drop of files that looked at the WPATH's intercommunications. And the fact of the matter is that they are quite aware of these adverse side effects. But aside from that, Jody, I mean, you can imagine the psychological harms that can come just by halting somebody, so-called halting somebody's puberty, because you can't really halt puberty. It's a developmental process, so you're interrupting something that is a natural course that should be carried out. So, you can think about the social ramifications of doing something like that, where a child would normally engage with the world around them and get a sense of their identity from that engagement. Well, these kids are encouraged to dissociate from the very essence of who they've been created to be. And that has enormous and immense implications. Just for example, we know that once kids go on to puberty blockers, it's almost assured that they will go on to cross-sex hormones. And then conversely, if you take a child who you just let them carry out, if they have gender distress, you just let that carry out, 85% of those kids will desist. So they won't go on to cross-sex hormones. So there are a number of implications here that are very detrimental, and they have little to no research to investigate those harms.
And we just need to constantly be aware of the authentic, true, scientific effects and impact, the negative things that these medications will do. Another thing that gets me, and by the way, I'm glad you brought up the WPATH files. I want to get to that in just a moment, because I think there's a lot that needs to be unfolded and brought to light with those files. But before we get there, there's a lot of people that say these medications are reversible, even fully reversible. The Endocrine Society, for one, is saying that, but that's not true, is it?
It's absolutely not true. And all we have to do is look at Jazz Jennings, who's been displayed for all the world to see. Unfortunately, what terrible abuse this child has gone through. And, there are certainly permanent effects of puberty blockers, just for one, let alone the cross-sex hormones. But when you're talking about puberty suppression, you're talking about sexual organs that do not have the opportunity to fully develop. And also, you're stopping the natural growth of a child's sexual organs. And so, of course, infertility is going to ensue. So how, to say that you can reverse a process that you have halted is just insanity. And as you said, with these WPATH files, we find that they know that as well. They're aware. The WPATH members are quite aware of what they're doing, and they know that these procedures are irreversible and cause permanent damage. Well,
I am just so encouraged with this that's come out of England. And as you mentioned, some other European countries, I know Sweden, Finland, for example, have made similar moves. And there are others that are in process. Even here in the United States, I think we have some 20 states now that have passed laws banning these puberty-blocking drugs and hormones, and some even have made it a felony for doctors to prescribe them. But do you think what's happened here with the UK in this announcement is going to provide more encouragement to slow down or perhaps even stop the momentum here in the United States for these puberty blockers?
I think this is great news, first of all. And I think that eventually it will be another thread that helps unravel this horrible ideology. Sometimes I've noticed, I'll speak as a clinician for a minute, sometimes I've noticed when people come in for therapy, a lot of times the situation will get worse before it gets better, because there's actually, God is bringing about freedom. And so sometimes the things that get stirred up in a person's life will get worse before it does get better. And I think that we may see this in our nation as other countries and other revelations about malpractice become evident and become increasingly more evident, that we may see those on the other side try to hunker down even more and ignore the truth of what's being revealed. And so I think
Absolutely.
we can't be discouraged by that. We can't, because it eventually we will see this tumble. And as you said, we have 23 states now that have put in protections for children.
Wow. Well, I'm with you. This is fantastic news, and I think it does bring a lot of encouragement. You've brought up a couple of times the WPATH files. Tony actually discussed this last week. I think these files really expose, by the way, the WPATH stands for the World Professional Association for Transgender Health. And there were some files that were leaked, and Tony talked about these. I would love to get your opinion about all of this. I think that also is huge news, the information that came forth from those leaked files.
Yeah, and what a gift. Now, these files don't tell us anything in one sense that we don't already know, but it is a huge admission of the fact that they also know that this is pseudoscience, that they're employing practices that really do not allow for informed consent. And the whole scientific process has really nothing to do with evidence. In fact, we have both medical malpractice and scientific or research malpractice at hand here, and that's what we're looking at. One of the things that I would say was most telling to me and most disturbing was to see the level of mental health issues that are going on with the people that gender therapists are treating, and that they're observing these huge mental health conditions that merit further investigation. And they're instead of really treating the root issue, they're bypassing that and just going for cross-sex hormone surgeries, etc. And that is really disturbing when you talk about people who have huge dissociative issues from probably childhood traumas or other types of traumas, and those are not getting treated, and instead they're being masked by this ideology. So that's quite sad to me as a clinician, to see people who are in the field that would ignore that, and they should know better.
They certainly should. You mentioned the whole issue that came forth or surrounding informed consent. Mm-hmm. I actually have a clip here that I'd like to play for you. This is a trans activist, Jamison Green, who could not deny exactly what you're saying. Let's play the clip, please.
And I know for a fact, people, even adults, even well-educated, older adults accessing care for the first time, sit down with the person who's going to prescribe their hormones, and they look at an informed consent form that says your hormones are going to do this, this, and this. They don't take any of that in because they're so scared that they're not going to get what they need. They just show me where to sign. Because this is my moment, I got to grab it. And they don't really take in the information.
Wow. Yeah, it should concern everybody, especially children. These kids are consenting to things that they don't even have the ability to understand. Give me your reaction to that clip.
Yeah, well, in this case, he's talking about an adult, but what you hear, the observation of desperation, and the people coming for this type of so-called care, they're desperate, and so they're willing to sign anything. And this is where, if it was a good practice, you would see a therapist or a medical professional taking time and really doing a thorough assessment and waiting before even attempting to start some kind of practice like this. But you don't. You see this rush to onboard people to very, really what is the most invasive practice that I've ever seen and has been in our recent days in the psychological fields. And I know another case where this gender therapist was saying, I worked with a person for about a year, and of course they had already onboarded them to all the gender ideology stuff, and the person revealed that they had been sexually assaulted, and that was one of their primary issues. So, you know, not the right treatment for these huge conditions that people are dealing with.
Absolutely, and it just seems to me that these files really confirm the fact that WPATH in itself does not even meet the standards of evidence-based medicine. Would you agree with that?
Yeah, they do not meet the standards of evidence-based medicine because the research just isn't there to support it. That's number one. But also, and I've testified about this as well, they don't have the proper measures to discern, is somebody, you know, really transgender? Are they non-binary? Are they fluid? Which, you know, for us, we recognize that those concepts are fallacious. We believe in binary sex. But even if it were true, you should be able to measure and be able to predict who is going to benefit from your treatment. That's part of evidence-based practice. And you don't see that
Absolutely.
in this case.
Dr. Jennifer Bauwens, thank you so much for your input. We appreciate it so much.